Another topic that begins to move us into how military care providers should perhaps respond to enemy soldiers who are prisoners, and specifically in interrogations. And what this point is illustrating is both an ethical conflict that's arisen, but also some of the thinking about the limitations of military docs being able to work to further the mission. Though, as we just said, military docs could go along with requiring a vaccine to be used that hadn't been fully tested in research. Okay, let's go back to Vietnam, where our troops were there, and there were civilians in South Vietnam that our military needed their help and support, ideally. We wanted to then, if possible, quote, win over the hearts and minds of the South Vietnamese people to help our troops. The question that arose there is, should military care providers use our medical goods as a means of winning over that civilian population's hearts and minds to our side? Well, one of the ways of doing that was with very dramatic medical procedures such as plastic surgery. So it was seen Vietnamese civilians could see us doing that surgery and maybe be very impressed and want to support our side. The ethical question that arose is, was that use of medicine as a means to this military goal, winning over the Vietnamese civilians' hearts and minds, something that was optimal or ethically justifiable or acceptable? In that context, there were two problems. One problem is that military care providers doing that could be construed, rightfully perhaps, as those care providers using the vulnerability of the civilians due to their medical problems and exploiting that vulnerability for our ends, as opposed to treating them primarily as ends in themselves, as people with illnesses and injuries that needed treatment. And as those of you familiar with philosophy know, that principle that came from Immanuel Kant, that generally persons should not use others only as means to another end, was impermissible. That was the first question. The other question was, if one really wanted to help that patient population medically, one might have said, what would help them most? These same docs treating their infections, treating them for a parasitic disease of some sort, and so on, they might have done something differently. So that issue emerged then. And there were many very severe critics of how military care providers had carried out their medical interventions, not their military interventions, in that context. Now, let's look at that from our view today. There can be two possibilities in that sort of situation. One, military doctors could be treating a civilian population, and they could be treating that population as ends because they basically want to offer them. And yes, an anticipated side effect, if you will, is that population might look more favorably on the U.S. and its mission. But the military care providers, even in treating that group as ends in themselves, can't separate the secondary gain to our military. And that might seem then as a good thing. Namely, our military care providers are, while in another country, trying to help them to whatever extent they can. Note, however, that at the same time, it could be that their actual intent is the same as it was in Vietnam, to win over the hearts and minds of the civilians. And maybe the fact that the civilians are benefiting, well, okay, that's not their primary goal. Good that it happens, but not the primary goal. Is there a way for military care providers often to know which is which, or for the civilians to know which is which? Maybe not. Maybe those determinations are made at higher levels. So maybe it's a matter of trust for soldiers, military care providers, those civilians, and the rest of the world, whether there's integrity underlying that intervention or there's not.